Awesome episode. I am here with Dr. Priya Mistry,
Yeah.
and she is just a ball of joy. I can't wait for you guys to meet her, but I want to quickly introduce her. I've been following her actually before I even had a podcast because there's not that many people that exclusively treat TMJ, and she's an expert at treating that. We're going to get into it. But a quick introduction. She became a dentist at the University of Pacific in San Francisco, but she's from Redmond, Washington, and she's been in the dental industry coming up on 20 years. So has a lot of experience, and she's been helping her patients smile with comfort and confidence since then. But things took a turn from general dentistry in 2018 when she met her mentor, Dr. Parker, who had been treating TMJ for 40 years. So they always say, show me your mentor, I'll show you your future. So it sounds like you had an amazing mentor training for 3 years under his training. She also has a diplomat status from the American Board of Dental Sleep Medicine, making her one of the few providers in the area who's qualified to effectively treat sleep apnea with oral appliance therapy. So we're going to get into a lot more, but she's very impressive, has a huge following on Instagram, almost 90,000 followers on there, has a big YouTube channel, just all over social media, people flying in from all over the country to see her. And she's a business owner, a doctor, a wife, a mom. So very impressive. So Doc, welcome to the show.
Oh, thank you. That was such an amazing introduction. Thank you.
Absolutely. Yeah, you're a very impressive person. And you also teach other dentists. I saw you have courses, so you teach other dentists. So, yeah, I know today we're mostly just teaching patients and our audience about, TMJ. And I don't even know if there's a lot of people that know there's dentists like you that exclusively treat TMJ, but go ahead and for our listeners, just explain kind of how you got into treating jaw problems.
Sure. I mean, I got really lucky. I met my mentor on a whim. I walked into his wife's jewelry store and her and I we're both chatty. So we got into a conversation and she told me that her husband is a dentist too. And he'd been treating TMD for like 30, 40 years. And I said, TMD only? Like you never hear of that. You hear sleep, a lot of sleep apnea and a little TMD.
Sure.
But you never just hear TMD. And I said, what on earth is he doing? And so I started shadowing him. I said, do you think he'd mind? And she said, no. So I went and shadowed him and the rest is history. The first day I was there, I was hooked and I took him to lunch and I said, I'm going to buy your practice. And he looked at me and he goes, okay. He goes, you have a 2-month-old and a 2-year-old at home. And maybe you should discuss it with your husband. And I was like, no, I'm going to buy your practice. And I think he probably thought he'd never see me again. But what I started doing is just shadowing him 2 days a week. I would just come in. It was unpaid. Like I was just observing.
And he's an Oregon guy?
The practice was then in Portland.
Okay.
Yeah. It was in Portland at that time. Yeah. And so I would just come in and I had a lot of support at home. My dad lives with us. So he would watch the kids for a few hours while I went and shadowed. And then I think Dr. Parker, my mentor, saw like my interest was real. And so he was like, okay, like let's work something out. So I started working for him. Then I bought the practice and I moved it to Vancouver, Washington, just 10 miles north. In 2021. And we did a whole build out there.
All right. Yeah. I've seen pictures. Haven't been there yet, but yeah, the office looks beautiful.
Well, you have to come see it.
I will. So let's get right into it for our listeners here. Can you talk about, what exactly is TMJ or TMD? I know some of these terms are just kind of thrown around.
I know.
But for somebody that is maybe new to this or has jaw problems, can you just simply explain, what that is and what is it that you treat?
Yeah. So TMJ just means temporomandibular joints. It just means jaw joints. So we all have 2 jaw joints, right? TMJD, temporomandibular joint disorder, or temporomandibular disorder, TMD, really refer to the same thing. So it's any problems with the joints themselves or the muscles that surround and support the head, neck, and jaw. So those problems in the joint sort of manifest as clicking, popping, crackling, or the jaw will start to lock or get stuck.
Yeah.
Problems outside of the joint are more with the muscles being angry, kind of being stuck in an angry state. And that can manifest as jaw pain, headaches, neck pain, ear pain, stuffy ears, dizziness, tooth pain, gum pain,
Wow.
numbness or tingling in the face or fingertips. So there's so many things that can come along with the muscles being angry
Yeah.
that people don't realize it. So sometimes people suffer from migraines or headaches,
Hmm.
and it's stemming from the jaw, even if they don't
Yeah.
have clicking or popping noises in their jaw joints.
Okay.
And so I think many people think, oh, I don't have joint noises. My jaw's fine. It's not coming from my jaw. But a headache can definitely be coming from your jaw.
Hmm.
Ear pain can be coming from the jaw. So a lot of ENTs will refer to us because
Okay.
they're like, this person keeps coming in with ear pain. There's no
Right.
infection. Their ears are clear.
Huh.
So it's a very interesting thing. And I think a lot of people don't realize that the
Yeah.
symptoms are so wide and varied.
Right. And as you've mentioned before, in dental school, it might not get the training or attention that it needs. Same with our chiropractic schooling. There might
Sure.
be a quarter just learning about it, but it does kind of get swept under the rug that
Yeah.
I've found.
Oh, totally.
And
Totally.
doesn't quite get this attention.
It doesn't get attention because there's not a lot of research,
Okay.
right? Like TMD can be a whole body issue. It can stem from your hips, but how do I prove that? Like,
Yeah.
I don't have time to sit there and prove that. So I think there's just not a lot of
Sure.
evidence. So then it's
Yeah.
not taught in the curriculum.
Sure. So for someone listening that thinks, oh, maybe my jaw is the source of, my discomfort or symptoms, how do you tell patients, hey, yeah, this might be a sign or symptom that the jaw could be the root cause of what they're experiencing? Or is it coming in, getting an evaluation?
Yeah, yeah. One thing I would ask people to look for is your pain the worst in the mornings?
Okay.
Because that tells you you've been clenching and grinding all night and it's probably
Yeah.
coming from your jaw. But some people have pain that's worse in the evenings after using their jaw all day.
Sure.
So that's not a tell-all
Sure.
right, for it. Coming in for an evaluation is always the best way,
Okay.
really, to know. But I have videos on my YouTube, like I think there's one called like, do I have a TMJ problem or something? So you could
Mhm.
always look at that too.
Got it. Now, for someone that, thinks, yeah, I got this pain, this jaw clicking, I know a lot of patients have gone to their general dentist and then they're like, yeah, I got a night guard. It didn't work. Can you just explain that?
Sure.
Maybe a general dentist, might be a little limited compared
yeah.
to what tools you have.
Certainly. So in dental school, we are taught if you have a TMJ problem, you make a night guard or a splint. They're
Okay.
kind of, those terms are kind of interchangeable.
And are those custom or?
They're custom in the
Okay.
sense that we take impressions of your teeth.
Okay.
And then we're taught to just build it flat,
Mhm.
usually on the top arch. So
Okay.
it's a plastic that goes all the way around, and it's kind of a flat surface for you to clench and grind against. So that's not really appropriate for someone that has a TMJ problem.
Okay.
That's fine to protect your teeth
From grinding?
from the forces of clenching and
Oh,
grinding,
okay.
because you could crack your teeth, right?
Yeah.
So it's good at protecting your teeth, but it doesn't treat a joint problem or a muscle problem, and it
Okay.
can often make those worse.
Wow.
That is what we did not learn in dental school.
Okay. I have heard
So,
that a lot.
Yeah. And so I have multiple patients that got a night guard, and suddenly after 4 nights of wearing it, their jaw locked closed.
Ooh.
Yeah.
Okay.
And I'm like, ugh, that's way harder to fix than if you had come to me before the night guard, but they didn't know, right?
Sure.
So what I make is I make a custom orthotic.
Okay.
So I also take molds of the teeth. So I think that's where
Uh-huh.
people get confused. Well, it is custom, but
Sure.
an orthotic is different
Okay.
because it's all about the relationship of your upper bones, the maxilla, to
Okay.
the mandible, the jawbone.
Okay.
And that relationship is super important. So we find the prescription, we find where to put the lower jaw in 3-dimensional space to allow the muscles to relax and the joints to decompress.
Okay.
And we build something that guides the jaw to that really specific position.
Okay.
It is a true orthotic. It
I
puts
see.
it guides the jaw to a different position to help everything heal. A night guard doesn't do any of that.
I see.
So and the word splint is like this stupid word that can mean orthotic or night guard. So I just don't
Okay.
even use it
I
because
see.
nobody uses it consistently.
Got it. Okay.
So I don't even like that word. But orthotic is truly different, and you have to go to somebody who really knows how to find that prescription. So
Okay.
sort of like all eyeglasses look similar
Sure.
and they fit similarly.
Yeah.
Orthotics can look like night guards and they fit over the teeth,
I see.
but it's the prescription built into those
I see.
that is invisible. The prescription's invisible to
Yeah.
the layperson, right? And so it's a prescription built into it that makes the difference.
Okay.
I know it's interesting. I didn't
Yeah.
really understand the concept first when I started working with my mentor. I was just like, wait, what are we doing? And
Yeah.
then as I started observing and learning, I was like, okay, I get it.
Wow. So part of that customization, like you said, is putting that jaw joint in the optimal position for it to
Mhm.
actually heal.
Yes.
Okay.
Yes. So positioning not only the joint, but the muscles.
And the
So we have
muscles.
EMGs, we measure where the muscles are firing the least
Okay.
and where the joints are decompressed, and we record that position.
Wow.
And again, it's the relationship of the maxillary bones, some people call it the upper jaw,
Mhm.
to the lower jaw, right? And if the teeth are trapping that in a really bad position for the
Mhm.
muscles and joints, we need to kind of open that up and get everything in a better position.
Right. That's awesome. Yeah. I mean, I didn't really know that until I started following you. And so there's a big difference there.
Huge, huge.
Yeah. So as a chiropractor, we see a lot of issues with the muscles, the upper neck. I know a lot of it's related, like you said. You do work with hand in hand with, upper cervical chiros,
Mhm.
PTs. So can you talk a little bit about that of
Yeah.
where maybe that team integrative care might come in?
Sure, sure. So, yeah, with people whose jaws are locked closed, this is a very specific condition. So it's not trismus. It's not where there's a muscle spasm and you can't open your mouth. That's
Uh-huh.
one thing. That's one way the jaw can lock closed. The other way is if the little disc in the jaw joint becomes dislocated.
Okay.
And when that disc becomes dislocated, it's all about the positioning of the jaw, and the
Mhm.
muscles of the neck contribute a lot to that.
Okay.
And so my mentor taught me that upper cervical chiropractors
Mhm.
have a way of kind of gently tapping C1, C2, kind of back into a
It's like playing Jenga
yeah,
with the
kind
upper
of,
neck.
kind of.
Yeah.
Yeah, that's a good description. And I have found that when they are able to line up C1 and C2 properly, the jaw unlocks faster.
I see.
It's
Wow.
really
Okay.
interesting for most patients, not
That's
everyone,
awesome.
but for the vast majority.
Uh-huh.
So I work closely with a few upper cervical chiropractors in the area. And
Yeah.
then,
Yeah. We both know Larry Burke down the street from here.
yeah.
Yeah.
Oh,
Okay.
he's just here. Okay.
Yeah.
Yeah.
It's in Lake O.
Yeah. He's really
Yep.
good.
Okay.
Yeah.
That's awesome. And also you refer out or maybe in-house do massage to the jaw.
Yeah.
And
Yeah.
I've found too, when someone says, yeah, it's my left side,
Yeah.
that their left neck's tighter, the jaw
Totally.
muscles, the SCM, that whole side seems
Yeah.
fired up as well.
Yeah.
But you also integrate massage.
So yeah, I do that myself. I
Oh,
do
okay.
all the hands-on therapy with my patients. So I kind of learned from my mentor, Dr. Parker, but then he had actually originally learned from a very prominent TMJ physical therapist, Dr. Mariano Roccabato. I don't know if you've
Okay.
heard his name, but he's
Uh-uh.
really well known in the physical therapy world.
Okay.
And so he incorporated some of his techniques into our protocol. And then I also work with some PRI, Postural Restoration Institute physical therapists.
Oh, wow.
And
Okay.
they're really great because many of my patients have forward head
Sure.
posture, right?
Yeah.
So they're able to help the posture, which helps take the weight off the neck,
Okay. Yep.
which helps the jaw.
Absolutely. Okay. That's awesome. Can you talk a little bit? I've heard you on some of your videos talking about sleep position,
Mhm.
pillows.
Mhm.
That seems to come up a lot if
I
someone
know.
talks to me about, I mean, obviously with their neck, but a lot of times with their jaw.
Sure.
And I'll even ask, like, are you sleeping the right way? And
Yeah.
so can you talk a little bit about that, about, getting a proper pillow or just what position? Is there a better one for someone that has a jaw issue?
Yeah, there is. And many people think it's sleeping on your back, and it's actually not.
Okay.
And so, sleeping on the back, I think a lot of people think like, everything's symmetrical, everything's balanced. And
Sure.
maybe that's true for like other areas. But what happens with the jaw
Uh-huh.
is that gravity pulls the weight of the mandible and the tongue back into the airway.
Okay.
So, a lot of TMJ problems and sleep apnea often come hand in hand.
Uh-huh.
So, now you're exacerbating the apnea,
Okay.
which is going to make people clench and grind more, which is going to make the TMJ problem more
Okay.
worse, right? And so I actually recommend that people sleep on their sides.
Okay.
Stomach sleeping is too much, craning the
Yeah.
neck to try to get oxygen.
Okay.
So side sleeping is what I recommend. And then the pillow I love is Pillowwise. I actually found out about that through Dr. Corey Burt, who's an upper cervical chiropractor in
Okay.
Beaverton. I love Pillowwise.
Tell us about
Yeah,
it.
I love it. And so this is like not an ad for them, but I actually just really like it.
Okay.
So it was created by a Dutch physical therapist, and they're
Uh-huh.
all made in the Netherlands.
Okay.
And so they are not allowed to put any toxic crap in their pillows
Okay.
like we're allowed to here.
Sure.
And so they're really good pillows. They don't like stink when you get them, like a
Okay.
lot of the pillows here.
Yeah.
So that's first off, I like. But second off, they're customized. So we take measurements
Oh,
from
wow.
shoulder to shoulder, from mastoid process to shoulder,
Oh, wow.
and
Okay.
then the circumference of your neck. And then, so we write all that down, and then we ask what kind of mattress you sleep on and what position you sleep in.
Wow.
And it's all plugged into an algorithm.
Okay.
And it spits back out the perfect pillow for you.
So it's a kind of custom made pillow.
It's awesome.
That's cool.
It's the best pillow I've found. And,
That's awesome.
I've probably sold close to 200 of them.
Okay.
And their PillowWise's policy is like, if you don't like it within 30 days, you can get a full refund. You return it to them.
Okay.
I mean, they're great. One person has returned it.
Wow.
One.
So you find getting someone to sleep in the right position, getting a good pillow, that will definitely accelerate their healing, or potentially.
Okay. Sometimes the problems are like so big, right?
Sure.
But
it's going to help.
It's going to help some,
okay,
right? At different degrees with different people. And, there are a few people who sleeping on their side actually makes their jaw locked closed. So obviously this is not like, there's always outliers to every rule.
Sure.
So if you're listening and you're like, oh my God, sleeping on my side makes everything worse, don't do that.
Yeah.
But like for most people, that's the rule.
Okay. Got it. When it comes to diagnosing the right problem, obviously, doing a good history exam, are there other tools that you use? I'm curious myself, X-ray, MRI. I know I've seen some MRIs of jaw, problems. You use that to look at the disc. And I also know you have some other great technology, like the tech scan. And so can you, for our audience, just kind of talk about other tools that you use, or sometimes do you not need any of that, right what it is?
Sometimes I know right away what it is, but I also want to make sure. So I always use a lot of it. Right.
Okay.
And so my mentor always said the mystery is in the history. So asking a thorough history, because sometimes people have had 4 whiplashes and they don't tell you that unless you ask, have you had a history of injury to your head, neck, or jaw?
Yeah.
And that's going to cause a big problem usually in the jaw too. Right. So I spend usually about half an hour just having the patient tell me their whole story. Then the physical exam is very different from what I learned in dental school. There's a really thorough palpation exam. I have a postural grid. We look at their posture. Sometimes I look at the gait. I look at their leg length lying down. If they give me permission, I'll even just gently place my hands on their hips to feel for any strains there. I'm trained in craniosacral work, so I check the cranial rhythm. I do a lot in the physical exam. And then in terms of imaging, everybody gets a CBCT. I have to see. So that's a cone beam CT scan. Yeah.
I know some chiros use that too.
Yeah, I love it.
Yeah.
I love the cone beam
kind of
CT.
like a modified CT scan.
Yeah. Yeah.
Right?
I mean, it's very focused on this area. So you can see the joints in 3D.
That's cool.
And that's super important because sometimes the joint is just destroyed.
Okay.
And the patient needs to know.
Yeah.
And I don't have x-ray vision, right? So CBCT, everybody.
Okay.
MRI is limited.
Okay.
If we're not sure if the jaw is, if the disc is dislocated without reduction, so it's just completely dislocated.
Yeah.
There are a handful of people where the disc dislocates and they can still open pretty wide, and it's rare.
Wow.
But I see it maybe a handful of times a year, and I'm like, you need to get an MRI because I don't know for sure what's going on.
You can't see that disc
in the
soft tissue, so
you can't see it in my CT. So those people get an MRI, not everybody. But we got this new instrument that I'm really excited to start using. It's called the JVA, Joint Vibration Analysis.
Okay.
And it's kind of like, it looks like what we're wearing, headphones, but it's actually just right on the joints.
Okay.
And it records the frequency of those noises and when they're happening in real time.
Like you have them open their mouth.
And close.
And you can hear crepitus and crunching.
And then you can use this flowchart to diagnose exactly what's happening in the joint.
As it moves.
85% accurate.
Wow. That's pretty cool.
Yes. And MRIs, you're dependent on who reads them.
Sure.
I almost like the JVA better.
Okay.
And so I love that thing. I just got it.
That's in your clinic.
It's in my
You don't have to send them out.
No,
okay. Wow. That's cool.
I love that thing.
Okay.
So I'm using all these different things. And then the DT tech scan.
Yeah.
That's a way of measuring the bite.
Okay.
Relative bite force.
And it's a lot higher level than a normal bite analysis at a general dentist.
Got it. So the sensor with the T-scan is 100 microns thin.
So it's something you put in their mouth and they bite, and then there's all these little sensors.
Yes.
Okay.
It's really cool. So you can see relative bite force with 95% accuracy.
Wow.
Do you want to know how accurate that little bite paper is that us dentists use?
Yeah.
So we're taught that the size of the mark is what's the right word? Is like consistent with how forceful you're biting on that tooth.
Okay.
That's wrong.
Huh.
we were taught wrong.
So they bite down and it has a mark.
It puts a mark on your teeth, like blue marks or red marks, depending on the color of the paper, the carbon paper. And we're taught that if the mark is really big, the force is really high.
Okay.
Right? That is totally wrong. My mind was blown when I took this course with the T-scan. So the bite paper is 14% accurate.
Oh, wow.
14. So would you rather have someone adjust your bite with 95% accuracy or 14%?
That's incredible.
Oh, it's incredibly embarrassing.
Yeah.
Right? It's like for
wild.
us dentists, right?
Yeah.
And so I use the T-scan to do a type of therapy called DTR, disclusion time reduction therapy.
Yeah. What is that?
Yeah. So we measure relative bite force and the way your muscles are firing in real time.
Oh, wow.
The temporalis muscle and the masseter muscle.
Wow. Okay.
And based off of what we're seeing with the bite and your lateral movements, because when we chew, it's up and down and right and left. Okay. There's no forward and back. We chew like cows. Okay. And so we see that if in those movements, there are teeth that are taking way too much force, or back teeth that are gnashing against each other when we chew. Okay. All of that stimulates the central nervous system, because the back teeth are the only peripheral nerves in the whole body that synapse directly in your central nervous system. Wow. So your bite will impact your central nervous system, period.
Crazy.
And that can cause a lot of pain.
Okay.
So if we can reduce the load on the central nervous system, we can reduce your pain. And we do that with micro adjustments on the teeth. I'm talking a micron here, a micron there. You're not even numb. It doesn't even hurt. Wow. But it can bring your pain way down.
Wow. That's crazy.
I've been transitioning from some people from orthotics into where I have like a 90% success rate, but there's 10%.
I saw that. Yeah.
Where I'm like, these orthotics are not doing it. Huh. Why? So we transition them off the orthotics and we do DTR.
Okay.
Boom.
Wow.
Amazing.
Wow. This is all, I didn't know any of this until,
And we watch the muscle activity go down as we make these micro adjustments, because then we check again. And we make a micro check again. It is amazing. And this technology's been around for 35 years.
Oh, wow.
But dentists aren't using it. It's just not gaining a lot of traction.
You think most dentists just don't have the time, the capacity to take that on, since they're so busy with everything else?
I think people have so many different theories on what the ideal bite is, that you pick one and you go with it. Mm-hmm. Like there's big names in dentistry and you go to these big courses and you're like, oh, this guy knows his stuff.
Sure.
So dentists become dogmatic about things, one. And two, it's humbling. You're like, oh crap, I've been kind of practicing.
Sure. Yeah. Well, if you're heading in the wrong direction, driving on your vacation and you realize, hey, I'm going in the wrong way.
Don't just keep going.
Don't keep going around the world, right?
I know.
Turn back.
I know.
Yeah. Sometimes you got to admit when you're maybe going in the wrong direction.
I think egos, dogma, like there's so many, things that contribute.
So let's get into my next question. And I've seen this on a lot of your videos. So once you get the problem or you diagnose them, you got a care plan, there's things that tools you can give to patients to help them, like the pillow. But I've also seen this really cool pen that you've showed on some of your videos. But what are other things people can do at home to help out?
Sure. And if you don't even have a budget for any of this, there are self massages that you can do with your hands, right? Okay. There's self massages and stretches. And I don't really usually recommend any exercises, because we're trying to bring the muscles out of dysfunction. Okay. And then if you start building them up a lot, like that awful like jazzercise ball.
So that doesn't give you the chiseled.
Oh my God.
Isn't that
it could give you the chiseled thing? Yeah. But it could also hurt you.
It could ruin you. Yeah. I know. I'm like, I don't know if I'd want that.
I know. So there's a lot of self massages. There's some neck stretches I really recommend, even neck self massages. Those are all on my YouTube channel and kind of everywhere. There's intraoral massages you can do on yourself.
Right. They taught us that in school, kind of that pterygoid release.
A lot of chiropractors and TMJ physical therapists use that pterygoid release.
Does work and helps?
Yeah. Oh, it totally helps. I used it. It happened once where I used it on a patient of mine whose disc was displaced. And I released her pterygoid and I heard a click.
Wow.
And the disc went back in alignment.
Dang.
I mean, that thing is, that's not always how it goes.
Sure.
But like, that was very powerful.
That's awesome. Are any other tools that you give patients? Like what's with the pen?
The pen is amazing. Okay. So there's a TheraPhase Pro. We'll talk about that first. That's made by TheraBody, TheraGun, that company.
Oh, okay.
The TheraPhase Pro is pretty amazing. It has some percussion, but very light.
Okay. I was going to say,
you can use it on the masseter.
That could be tough if it's a normal.
Yeah. It's not that big TheraGun. It's much smaller. but I only recommend using that on the masseters.
Okay.
It's too much percussion for the temporalis, in my opinion. But it also comes with so it has a percussion head, a heat head, a cold head, and red light. So it's expensive.
That's cool. How much is it?
It's $530 on Therabody, $530, $419 on Amazon.
Okay.
I just researched this yesterday. That's why I know this. And then there's the TMJ massage pen, who was made by this amazing guy, Noam. I think he's a mechanical engineer whose jaw locked closed. He was in severe pain. No one could help him. He's on the East Coast, quit his day job, made this TMJ massage pen out of his apartment. It is vibrating and heat. Wow. So it's not percussion.
Okay.
So it's a little more gentle. Yeah, it's different. But you can use it on your temples. And I even think gently on the back of your neck. Okay. Don't get crazy with it. But it has different levels of heat and different levels of vibration. So it can be very gentle to like a little bit more vibration.
That's cool.
And people really like it. I think that's $250. And you could use, I have a code like the TMJ Doc 10 for 10% off of that. Okay. But I love that. It's called the My TMJ Relief Massage Pen or something.
Okay.
Yeah.
All right. We'll put a link in here somewhere.
Yeah. But I just love his story and that he like quit his job to help other people. Like
that's wild.
He's a nice guy and he has made a good product, because I was actually thinking of trying to make that.
Wow.
But I don't have enough time in the day to barely do anything. So I was like, I don't know how I'm gonna do this. And then he came to me and he said, guess what I made? I was like, wow, this is perfect.
That's awesome.
This is what I was trying to make.
That is cool. Yeah. Okay, that's awesome. And those aren't on Amazon. You go direct to
you go to My TMJ Relief.
Okay, that's great. You've mentioned this a few times, but I want to hit on this because I hear this a lot. And you tell me if you think this is significant, but it sounds like stress might be a big one as kind of a root cause or amplifying jaw issues. Can you speak to that with people, clenching even during the day, at night, grinding, and how do you help someone through that?
Sure. Stress is hard. Well, the number one reason they say for clenching and grinding is actually sleep apnea. If you're struggling,
sleep apnea.
That's what they say. Okay. That's what, and so if you're struggling for oxygen, your body goes into fight or flight mode. When we're in that stressful mode, we tend to clench and grind, because grinding the jaw forward opens the airway. So it's our body's way of saying, I can get better oxygen saturation.
So grinding your teeth will get you better. Okay.
It's like the chin tilt in CPR, right? You bring your jaw forward, your airway opens more. So grinding forward will, yes, for sure. It's very hard to grind backwards. We can't move back that much, but we can grind forward from side to side, right?
Sure.
Another reason people clench and grind, though, I've figured out with DTR, disclusion time reduction therapy, is their body, your central nervous system, your body, your brain intuitively knows you don't have a good bite. You're trying to clench your way out of that bite. You keep clenching and and trying to find a new position.
Unconsciously.
You don't even realize why or what you're doing, right? And so we found that when we give people the perfect bite, many of them clench less.
So they might think it's stress, but it's just the bite.
Stress will make you do it more, but it could really be your bite. And your bite, an imbalanced bite, is a type of stress for your body.
Sure. Yeah.
Right? It's constantly stressing out your central nervous system. So stress, it's so interesting. Yeah, emotional stress is what we all think of, mental stress.
Sure.
Of course, if we're very stressed about something in life, like I had a patient who was doing so good, and then her dad went into hospice and she started clenching with more force, more frequency, longer durations, and she had a flare. But we got her back.
Yeah.
And so, when we're emotionally stressed, we'll clench more.
Yeah.
But why are we clenching in the first place? Right? I don't think it's all emotional stress why we're clenching in the first place. I think there's other underlying reasons, and an imbalanced bite, and I'm realizing more and more, is a big one.
That's very interesting. I have not heard that before. And I mean, even my dentist, has been like, I think you might be grinding. And I mean, maybe I need to
come see me.
Yeah, come see you. So yeah, that's kind of eye-opening. Thanks for bringing that to our attention. All right, we already talked about the night guard versus the custom orthotics. Thanks for sharing on that. Is there ever a point where you would need to refer someone out for surgery? Or do you feel that most of the cases can be treated successfully, conservatively?
Yeah.
And when is it, appropriate for that?
Yeah.
Because I've heard some patients say, this doctor wants to send me for surgery.
Sure.
I'm like, well, I don't think you've got a full workup here.
Like a full surgical case. Yeah. In the 7 years that I've been doing this, I've seen thousands of patients, and I've probably referred 3 to an oral
Oh,
surgeon.
wow. So very few.
Yeah, it's very few. Like when the jaw is locked closed, where the disc is dislocated, and we are not having luck, I usually am like, what is going on? So we get an MRI, and in a few instances, the disc is torn in half. I can't recapture that. It's 2
Yeah.
pieces. So then they have to see a surgeon.
What
right?
do they do? Is there like a replacement or they take it out?
There can be a replacement.
Oh, wow.
And then some people, the joint is so destroyed, like they'll do it. They'll recommend a total joint replacement.
Wow.
I haven't actually seen that happen. I had one patient where her condyle, the little bony knob the jawbone ends on, just kept growing and growing and growing. And when it grew, her whole jaw shifted.
Holy smokes.
I can't help that.
Yeah.
Right. So I have to send her to surgery.
Okay.
So there are some
Very
cases,
few.
very few. I mean,
Yeah.
it's been a handful in the last 7 years.
Okay. Wow. Okay. And then tell me a little bit about how you help people with sleep apnea, or you can help people with that. And if they have a CPAP and they're having jaw problems, you can really walk them or help them through that.
It's tricky. So CPAP is like the gold standard, right? That's what is the most effective, I guess. But some people just can't tolerate it. And if you can't tolerate it, like they rip it off at night without even realizing it. So they're not even getting the benefit of it, right? So if you just can't tolerate it and you still want to treat your sleep apnea, I can make an oral appliance that pulls your jaw forward to open your airway, right?
Got it.
That does come with some risks. Your bite can start to adapt to that position. Like we don't want that. So we have ways to like counter that from happening to deal with those risks. The tricky part though, is that people that have severe TMJ problems should not be getting that type of appliance. It can make their pain worse.
Really?
So most of the people that see me have severe TMJ problems.
Right.
And so like, they're not like looking for a sleep apnea oral appliance. They're like, I'll use the CPAP, but help me with my jaw.
Okay.
And then there are some where once their jaw pain is gone and they're doing well and everything's stable, we then use the prescription built into the orthotic and build that same prescription into an oral appliance for sleep apnea.
Okay.
And then we transition them into a different appliance that's like keeping the TMJ stable, but treating the apnea.
Okay.
So I can do a lot, but like, it's interesting because there's so many TMJ and sleep centers. If you just Google that, you'll come up with thousands all over the US, right?
Right.
They're mostly doing sleep. It's like this much sleep and this much TMJ. And I'm doing this much TMJ, 90%, and this much sleep.
I see.
And it's almost stupid because sleep is way easier to treat.
Okay.
So I'm like, if you have sleep issues, you can come see me.
Sure.
Get tolerate your CPAP.
I see.
That's a slam dunk for me. But
I see.
The TMJ is hard one.
Yeah. And I'm willing to bet a lot of docs just don't want to get into it. It's too complicated, too hard.
Yeah.
I don't know how to treat this effectively.
Well, it's interesting because I'm offering a course for dentists.
Okay.
It's limited to 12 because I'm going to teach them my hands-on therapy. And I think only 6 have signed up because I do think it's intimidating.
Yeah.
It's hard to treat. These people are in so much pain. And there's a lot of emotions and there's a lot of stress and there's a lot of, I can't even tell you how many people cry in my office in a week.
Wow.
Right?
Just like no one understands me. I can't get the help.
I was told I was crazy and I know I'm in pain and they're not, a lot of them are not crazy.
Right.
In my 7 years of doing this, one person has been a drug seeker. And it took me a while to see that because I'm hopelessly naive and I trust everyone.
Yeah.
So, so I, it's tough to treat TMD. It's not an easy thing.
So tell us a little bit about your practice. We talked about it before, but I mean, you have a big social media presence and you have people fly in from all over the place. And so tell us a little bit about your practice.
Yeah.
And then, what is kind of a normal treatment schedule?
Sure.
Do they come in for 1 or 2 visits? Do they stay for a week if they're out of town?
Right.
Can you
How does
talk
that work?
Yeah.
So the first appointment is always like a new patient exam. And if you're not local, I can do an online consultation.
Okay.
That's not as thorough because I can't do an in-person exam, but I can usually give you a fair idea of what's going on and at least some sort of estimate of how much it would be if you did fly out.
Okay.
Right. For anyone that does fly out, I always do the full exam. I just don't charge them for it because they already paid for the online one.
Okay.
So, and then when they fly out, they're committed to treatment because they already know the fee. So we do the full exam and then we just start treatment. So for the people that fly in, like we do as much as we can at every appointment. Okay. But the tricky thing is, depending on the severity of the TMJ problem, you have to come back.
Right.
usually multiple times.
Yeah.
If your jaw is locked closed, you can barely open more than 1 or 2 finger widths. That disc is dislocated. You're going to see me 14, 15, 16 times. It's a
Right.
commitment.
Yeah.
Like you know, you're not going to see me twice and be unlocked. That's
Right.
just not how that works. And
Yeah.
so there was somebody that flew in from Toronto without even telling me
Wow.
and lived here for like 4 months. He
Wow.
just showed up and he happened to
Okay.
come on a day where I was like, I think I have COVID. I have to get the kids tested. And so he saw my mentor. This
Oh,
was back in
okay.
2021. And he was livid. He was like, I came here to see her. I
Wow.
saw her YouTube videos. And my mentor was like, I taught her
Yeah.
everything. Like, you don't need
You
to be
just have
this
that
mad.
magic
Yeah.
touch, I
Well, he's
guess.
like, you don't need to be this mad. And you didn't even tell us you were coming.
Yeah. Right.
So like, what the
Wow.
heck? Yeah.
Wow.
But no, he was really nice. He was just not happy that first day. But he stayed for 4 months. And then
Wow.
he got an extra set of his daytime orthotic and nighttime orthotic. And he was like, bye. I haven't heard from him again.
Okay.
Yeah. So people will fly out. They'll, it's really hard when you can't open your mouth and you're in
Yeah.
pain all the
No
time.
kidding. Yeah.
Yeah.
Would you say most of your patient base is Portland, Vancouver, Washington area,
I
kind of
don't
this
know
market?
anymore. I
No,
don't know
it's
anymore.
all over,
It's
huh?
all over now. Like
Okay.
at least every single day we have 1 or 2 people flying in. Yesterday I had 2 from
Wow.
Florida.
Wow.
So I don't know anymore. I don't even
That's
know what the
pretty
percentage
incredible.
is. Yeah. And there's only 4 of us.
Okay.
So I'm like,
You
it's
mean in
really
the
hard.
country?
There's only 4 of us in my office.
Oh, okay.
So we're
in
not
your office.
tracking
Okay.
like who's local and who's not. We're just busy.
Yeah.
Yeah. We're just so busy that we're just too small to track
Got
that.
it.
So yeah.
Do you, I mean, you probably know the other heavy hitters that are in this
Yeah.
industry. I mean, in the Pacific Northwest, is there really very many doctors that
Not very
do what you
many.
do?
There's Dr. Ben Sutter. He's in Eugene.
Okay.
And he is the guy that taught me DTR.
Okay.
He's like the DTR guru.
Got it.
He's amazing. And then in Pittsburgh, Pennsylvania, I have a good contact. In Kansas City, Missouri, in Burke, Virginia, and probably that's who I'd feel comfortable
I
making.
see. So really a handful. Yeah. Well, I didn't know how famous you were till I had you on here. I mean, that's pretty incredible having people fly out like that. But when you're that niche down and
Yeah.
you know you're in pain, it's hey, I
I
don't
feel
care what it's
bad for
gonna.
these people. And it's a lot of pressure for me.
I bet
I better perform.
if it doesn't go good,
I
then
know.
yeah.
I feel for these poor people.
But I mean, like you said, your success rate is
It is high.
I
It's
mean,
not 100%
90?
though.
Yeah. I mean,
Yeah.
that's pretty high to me.
That's pretty high.
I'd be willing to spend money on it if that
Yeah.
was,
Yeah. Yeah.
So that's amazing. So if someone's listening, they want to, hear more from you. What are the main, channels or
Yeah.
sites that they can go to
Gosh,
get more information?
Yeah. I'm everywhere. I mean, Instagram, TikTok, YouTube,
Okay.
Facebook, you name it. I think my YouTube videos are the best.
Those are
but
more long form,
they're
15,
long
20
form.
minute.
Yeah. And
Okay.
you'll get the most information.
Yeah.
But that's my lowest following.
Okay.
It's so interesting. My highest is on Instagram.
Okay.
And those are, reels can,
Sure.
they can't be that long. So,
Yeah.
but I think there's a lot of information there.
Yeah.
So yeah, those are the 2 that I
Yeah. It
probably.
looks like you've been building up this library information. I mean, yeah.
Yeah.
A lot of great, incredible videos and free information. So
Yeah.
that's awesome. But your office is in Vancouver, Washington. I know my wife's from Canada. So
Yeah.
people are always like, oh, British Columbia.
I know
It's like,
immediately.
there's another Vancouver.
Yeah. Yeah.
Yeah. Well, any other closing thoughts? Anything that we didn't hit on that you would like to talk about?
Well, I guess I would just like to ask you, like, what you see with whiplash and TMD.
Yeah. I would definitely say anytime someone has whiplash that, yeah, TMD is definitely a common sort of secondary symptom. Usually they're coming to us for, the neck pain. And kind of same with you, you start taking a history and any jaw pain, clicking. Well, yeah. How'd you know? And,
Yeah.
so definitely that comes hand in hand.
Sure.
And just with a lot of neck pain, I'll just ask them or I'll palpate and just like, holy cow, this feels, super tight.
Yeah.
And they'll be like, yeah, my neck hurts, my jaw hurts here. So I've kind of learned over the years to ask about that. But yeah, our tools are definitely more limited than what you've had. But I would say some of them, if we're able to, get their neck corrected, adjusted right, we have, massage therapists here too.
Mhm.
So they'll do a lot of, work on the masseter, the scalings, the SEMs,
Mhm.
temporalis, and
Lovely.
if it's just a mild case and it's just some tight muscles, pulling the jaw out of alignment, then I do find, it can resolve.
Yes.
But there's definitely some,
Where it's
and
more.
many where I'm like, hey, this is beyond my scope and you really need to go see someone else.
Yeah.
And now that I know you,
Yeah.
you're going
Send
to be
them
a
my
big
way.
go-to. So yeah, we don't treat a lot of TMD here
Sure.
market to it. Just there's people that do it better and we kind of know our lane and what we're good at. But I think being aware that it's tied in is great. And yeah, there's other great doctors like, Dr. Burks and these other upper cervical doctors who I want to have on that I think are just better than us. Like I told you, we're more of general chiropractors, full spine, hands-on adjusting.
Love it.
But yeah, I do see it. And, I've had some cases where they have had MRIs and this problem. So, enough to kind of know a little bit.
Yeah.
And we've had acupuncturists here too. We don't have it in-house anymore, but I found that for some cases, and maybe you've seen some of that too, where acupuncture can kind of help calm those muscles down. And I've even seen it quite effective with like Bell's palsy and some other stuff.
Isn't that amazing?
Stuff around here. So you've seen it help too with acupuncture?
I'm a huge fan of acupuncture.
Okay.
Yeah. It definitely does help.
Yeah.
Yeah.
Well, thanks for coming on, Doc.
Aw.
Yeah, I appreciate you. I know that was a long drive from Vancouver down here, especially rush hour on a Friday.
I'm such a lazy
the kids
driver.
are getting out of school. Pretty soon there'll be
me.
self-driving cars and you can work or take a nap in the car.
I'd be creating content.
Yeah.
I'm like, stuff to do. I don't want to drive.
Yeah. So yeah, thanks for your time. I really
thank
appreciate
you.
you coming on. And yeah, I look forward to getting this episode out there and helping everyone know about you and that there's help out there. So
Yes.
thanks so much, Doc. Thank you for coming on.
Thank you for having me. It's been